Hello, I'm Dr. Orlando Landrum here with Biohacking Your Pain podcast, and I am privileged to be able to have Dr. Phil Harrington with us today to talk about lasers and how it can be able to impact one's health. Just giving a quick synopsis so you understand who we have as a guest. He is a gentleman who studied physics in undergrad, knows it backwards and forwards, is a doctor of chiropractic from Palmer College, which is one of the most phenomenal places for chiropractic study, and is one of the premier lecturers for medical laser in this current day and age nationally, as well as having done international lectures and written a number of papers as well. So it's my pleasure to be able to have Dr. Phil Harrington as a guest, and we're going to get down and have a discussion about the nitty gritty of how laser can be able to provide value to patients and individuals that really need help. Dr. Phil Harrington, thank you so much for joining us.
Dr. Landrum, what a wonderful opportunity to be here with you and with your audience and with your patients today. I sincerely appreciate the opportunity to speak with all of you today.
Thank you so much for joining us. So I have a question for you. Can you explain, what's the underlying differences between different lasers? Because I know that many people have this thought process, laser, well, we're thinking about Star Trek or Star Wars, and people are getting zapped left and right. Is that like a
Yeah.
lightsaber, or are they shocking things and burning stuff? Can you give us some ideas about what different lasers are and what type of value they provide?
Yeah, that's funny. Anybody that's ever seen the Austin Powers movie, you've Dr. Evil and the whole laser beam and that sort of thing. I was joking with my wife before we started here is that I should have been holding our Boston Terrier Harley, and I could be Dr. Good talking about lasers. But basically with lasers, you can break it down into two different types. Lasers that cut tissue and lasers that do not cut tissue. So the lasers that we are talking about here today do not cut tissue. They are non-ablative. They are healing lasers. And so with the lasers that we are talking about today, we are using wavelengths of light that are red and infrared, which means they are non-ionizing and therefore very safe. And we are applying them in a manner that the reaction from the tissue is that we are creating photochemical effects in the tissues. What does that mean? Well, everyone knows that plants, if you look outside and see trees and plants in the sunlight, you know that those plants can absorb photons of light from the sun and convert that into chemical energy for use by the plant. In a similar way, our bodies and then animals' bodies, our pets' bodies, can absorb wavelengths, photons of light of different wavelengths, and that induces different effects inside of the tissues in the body that essentially help the body to heal itself. So there are, as I said earlier, the ablative lasers that will cut tissues, and historically those were called the hot lasers. And what we are talking about in this discussion today is the therapeutic lasers. To some extent, it's a little bit unfortunate that they have been given the nickname of cold lasers because there's really no sense of temperature. There's no sense of coldness. I much prefer that we call these a therapeutic laser because it is a therapeutic effect that is happening in the tissues.
Okay. So thank you already for getting down to the nitty gritty of it. Let me ask you this. So supposedly there's different classes that if someone was to Google and look for a medical laser, there's class 4, class 1, all those different elements. Can you give us an understanding about exactly what does that mean?
Right, and that's a little bit of an unfortunate history in the history of laser therapy. And let me just say that the everyday term that we use in conversation is laser therapy. The official term, if one is to do some research into the topic, is photobiomodulation. Photobiomodulation, which is abbreviated PBM. It's unfortunate in the history of laser therapy, that there has been this battle between the classes of lasers. And I think we are coming to a point in time now where people understand that a class 4 therapy laser, number one, is safe. The treatments that we are delivering are very safe because it's non-invasive and we're using non-ionizing laser light. But then also, a class 4 laser is by definition higher in power. And being higher in power, that gives us two things. The first being that we can, by shining a brighter light at the surface of the tissue, we can get more light deep into the body. But then secondly, because it's higher in power, it's delivering more energy per unit of time so that we can effectively treat a larger volume of tissue in the patient as compared to a class 3 laser. So early on, there were many researchers in the field of photobiomodulation that were pushing back on the class 4 therapy lasers because they did not completely understand the parameters and the involvement of class 4 therapy lasers. But now we are seeing that those same researchers are embracing class 4 laser therapy in the treatment of various pains and various conditions that we're going to talk about during this interview.
Thank you. So, Dr. Harrington, we're 6 minutes in, and we can already tell that you're way fancier than me. So, the thing that I really want to kind of talk about is, so a number of individuals will say, you know what? Well, how can I find more information about this? How can we be able to really say, how can I get some further insight about understanding the literature and all those type of things? And as I understand it, you have a website, right? So it's drphilharrington, right, .com, that goes into depth and details about a number of different articles and videos and references and things along those lines. Can you tell us a little bit about that?
So that is my personal website, and you saw my tagline there, the world's foremost proponent of class 4 laser therapy. Hopefully, if you haven't seen it already, Doctor, by the end of the interview, you'll realize that, I don't have anything to hide. I don't have an agenda. I'm not an ego-driven guy. I'm just a guy that grew up on a farm in northern Iowa, and the circumstances that have my path of life has brought me to this point now where I serve as the medical director for a class 4 therapy laser company, and I am able to communicate with doctors such as yourself. I'm able to talk with doctors that use our equipment in their practices. I'm able to hear the success stories from their patients. And I really enjoy being a proponent of this technology. I'm very enthusiastic about it. And it is something that it really drives me. And so, yes, I welcome patients. drphilharrington.com. If you want to go to my personal site and find more information there, or there's a contact form if you want to ask me any questions. I certainly enjoy getting questions from individual patients.
Okay. And as I understand it, you also do an in-depth podcast too, that I think if we kind of flash it up real quick, that's on SoundCloud.
Mm-hmm.
That's Laser Lessons from Dr. Phil. Not to be confused with the other Dr. Phil, but the real Dr. Phil, who's going to talk about laser therapy, right? That they can also be able to get understanding there as well. Is that correct?
So with that with that podcast series, and then actually, I guess I didn't share with you, I also have beginning my YouTube channel. I'm just wanting to give proper information about this therapy, about this modality, how it works, why it works, what conditions we should be using on, answer all of the questions that a patient may have about it. Because in my 15 years of experience with it, I have seen laser therapy become a modality that has really become standard of care in many ways in both human and animal medicine. And so, when I lecture on laser therapy, I tell the doctors, this is not a fad. I think both you and I have been in practice long enough that we had seen things that come and go. There's been a number of different fads, and it could be, fads that are directed towards patients, things that are sold on eBay or QVC or whatever, but then also things that we would see at our professional conferences or in our professional journals. There have been a number of fads in healthcare, whether the healthcare practitioner is a chiropractor or a medical doctor, whatever their method of practice is. laser therapy is here to stay. And there are many, many reasons why I sit here talking with you and I say with great confidence that laser therapy is here to stay.
So let's get into that reason of why it's important to you. Because to me, I think that's hugely important. And for our different guests that have come through, and we've had the pleasure of being able to talk to individuals, the motivating factor of understanding why this is so visceral, why it's so connecting to you. Can you give us an idea about exactly how this sort of swept you up and you have said, you know what, this can impact so many people and change their lives for the better?
Right. So I think it gets back to asking yourself, what is your own why? Why are you here? Why were you created? Why were you born? Why are you on this earth? What purpose do you serve? And thankfully, I've been able to answer that question. And the answer to my why is class 4 laser therapy. I am here to collect and synthesize and analyze information about laser therapy, and then turn around and share that information with doctors and patients, so that at the end of the day, those patients can benefit from class 4 laser therapy. And Doctor and I were speaking a little bit before the broadcast began about a certain case, and I became emotional about it, and that could very well happen again here, because my why is seeing the patient who is in severe pain. Maybe they've had surgery, or they've been on a number of different prescription medications for pain for a number of years, and we treat them with class 4 laser therapy, and their life turns around. Maybe they were suffering from a musculoskeletal complaint, plantar fasciitis, or low back pain. Maybe they were suffering from a neurological complaint, such as Bell's palsy or trigeminal neuralgia. Maybe they are suffering from diabetic neuropathy or chemotherapy-induced neuropathy. And standard medical care has not had an answer for them. They've gotten the pills, they've had the surgeries, they're still in pain, and they don't feel good. When you don't feel good, you don't treat other people very well. When you don't feel good and you go through the checkout line at the grocery store, you don't smile, you don't make nice comments to the checkout clerk, you're just not a nice person. Whereas if we can take someone and treat them with class 4 laser therapy, take away their pain, improve their quality of life, and make them happier, then it has that ripple effect throughout the world. And so in their own world of being able to be pain-free and feel good about themselves, so that they can have more positive interactions with people, so that they can be off of addictive pain medications, and so they don't have to deal with that addiction in their life. They can live pain-free with laser therapy. But then also how that ripple effect carries on their friends, their family, their work, and how that carries on to the whole world. So the reason I am so confident in the future of laser therapy, that it is here to stay, is because I have seen the wide-ranging ripple effects on patients' lives. I have heard from patients who were seriously considering suicide as an option. They were suffering from trigeminal neuralgia pain, which is the pain in the face and the head. The pain was so severe that on their list of options, suicide was an option. And then we treated them with the laser, and just a few treatments later, maybe it took 10 treatments later, their pain is completely gone, and they have a new lease on life. How much did it change their life? How much did it change their interaction with their kids, their family, their grandkids? And in a similar way, when we talk about neuropathy, when we talk about diabetic or chemotherapy-induced neuropathy, it's a progressive disease. It's only going to get worse if we don't do something about it. And we've had so many patients' lives have been turned around because of class 4 laser therapy treatments, that now they can be pain-free and functional. So, doctor, my why is that ability to use light. I mean, at the end of the day, that's what we're using is light. Laser is light. We're using light to improve people's quality of life. And that's a really big thing.
So you mentioned a number of different disease processes as you were kind of describing this. Is there an ideal patient, and are there any patients who are not candidates that for this type of treatment or therapy?
So for someone who is new to laser therapy, if this is the first time you've heard of laser therapy, one thing to realize is that we are not specifically targeting conditions in the body. So if you have a problem in the shoulder, whether that problem is an AC joint, the acromioclavicular joint sprain, or if the problem is a rotator cuff injury, or if it is, any other problem in the shoulder joint, we're going to use the laser on there. Laser is not targeting a condition, rather it is helping the body to heal itself. And once again, we could go very deep into the science behind it. And that's something that I want to assure patients that, yes, there is solid scientific basis behind what we are doing here, studies into the mechanisms and conditions treated. But basically, it breaks down to 3 bullet points. With laser therapy, we are increasing blood circulation, we are increasing tissue oxygenation, and we are increasing cellular activity. So let's back up. Increasing blood circulation, regardless of your level of knowledge, anatomy and biology, I think you would all agree that we need circulating blood in our body to stay healthy. What does that blood do? It carries oxygen. When we breathe, we have the exchange from the oxygen that we breathe in. The exchange occurs in our lungs, and then our circulatory system carries that fresh oxygen all throughout to all parts of our body. And then finally, that oxygen and nutrients that are also carried in the blood, those oxygen and nutrients are utilized by different cells in order to produce energy, and then the cell can function and do its job. So with laser therapy, we're helping circulation, tissue oxygenation, and creating more cellular energy so that the body can heal itself, which, at the end of the day, we were created as self-healing organisms. And once again, how beautiful is it that we are using light to do that?
Are there any patients which probably are not an ideal candidate?
Um, we do. There are certain contraindications that we have, but actually the list of contraindications is very short. Asking about a certain patient, I would say in general, no. But the contraindications that we talk about, number one is going to be, and the first one is pretty obvious, we're not going to shine the laser directly into the eye. However, it is safe to treat over the sinuses, over the forehead. One area of exciting research is using transcranial laser for different cognitive function, for different neurodegenerative diseases. So the number one contraindication is we will not shine the laser directly in the eye. The second contraindication is we'll be very careful about treating directly over the thyroid gland. And then the other two major ones are going to be a pregnant patient and a cancer patient. We will be very careful about treating those. But your general question about, is there a patient that cannot get laser? The answer there would be no, because we are using non-invasive, non-ionizing, safe laser light, and it would be okay to laser those patients.
Okay, why don't we show a few images of different treatment options that you have, and then you can kind of tell what's being done in each one of those different segments, if that's okay.
Okay, yeah, and so while you're pulling up the picture there, I'll just say that the first use of lasers is going to be for the musculoskeletal conditions. And use in chiropractic offices, it's going to be musculoskeletal complaints. So here we see a treatment being done on the cervical spine. And of course, this was an image that we took for demonstration purposes. But in a clinic, this patient could have any number of diagnostic problems going on with their cervical and upper thoracic spine. One beautiful thing about lasers is that it is tremendous at resolving myofascial trigger points. So, if you poke into your muscles in your upper cervical spine, your upper trapezius, and you feel those tight spots, those trigger points, laser therapy is fantastic at resolving those trigger points to help with any myofascial pain syndromes that you have. The treatments, of course, that was a static picture that we saw there, but the treatments are done where the laser wand is just kept moving over the treatment area. Here we see a low back treatment being done. And again, this patient, it could be low back pain. It could be a sports injury involving the lumbar spine. But then also, this is where we would start our treatment for the patient with neuropathy, start treating in the lumbar spine. One thing I'll point out, and you should see this from the pictures, laser treatments must be given on the skin. And that is one of the unfortunate things in misinformation in the laser industry. There are still a couple of laser companies out there that teach doctors and patients that we can deliver laser treatments through clothing. That doesn't happen. That is fraudulent. So as you see in the pictures that or that we're showing here, laser treatments must be delivered directly into the skin. And so whatever patient positioning or gowning things that need to be done, we'll just be shining that laser light on the skin. What does it feel like? It's a nice, soothing, warm sensation. It's non-invasive. Actually, in my chiropractic practice, back, thinking of that lumbar picture, honestly, I would have patients that would fall asleep on the treatment table because the treatment was so soothing and relaxing. The treatment being done here could be for a sports injury, an ankle sprain, or any other condition affecting the ankle or the foot. So you see there, the treatments are very easy to do. You see the laser unit sitting behind the patient there, just over his waist, and the laser light is created inside of that device, and then the laser energy is carried to the patient through a fiber optic cable to that treatment wand, and then that laser light is just shined on the tissues that we want to treat. So, treatments they're very easy to do, and it's beautiful in the sense that in a standard clinical setting, that staff members, nurses, massage therapists, other people can be doing the laser treatments.
Okay, thank you. So, what's the company that you represent, and how is it unique compared to other companies?
So our company is Sumus Medical Laser. Sumus is the Latin word for the peak, the pinnacle, the highest, the greatest. You may, if you, doctor, I'm sure you graduated summa cum laude several times.
I'm going to let you continue, but that is true. Go.
So our company is branded as Sumus Medical Laser. We did start out our company with another brand name, but then we have branded ourselves as Sumus. What makes our company great is that, number one, we're the granddaddies. We've been here the longest. We had our first equipment FDA clearance in March of 2005. So we've been at this for over 15 years, and we have that accumulated body of evidence and experience and cases that goes along with simply being in business that long. But, yes, we are the oldest, the longest standing, the most experienced, but we don't stand still. That's one thing that I give tremendous credit to Dr. Richard Albright, our company president and founder, is that he was always looking for ways to create laser technology that is going to improve the lives of patients, that is going to be as easy as possible for clinicians to deliver the most effective treatments. So something that we pride ourselves on is our level of education and our responsiveness to our clinicians. And that's a big thing, and that should mean something to patients also. When doctors buy a piece of equipment, they rely on the company to provide support to help out. And for our company, quite often that's going to be clinical advice. And that is something that I will get the emails, phone calls, text messages, Facebook Messenger messages from our doctors that have our equipment, and they want an answer pretty quickly. Gee, Dr. Phil, I have this patient in with this condition. How should I treat them? Or what setting should I use? Or how can I help them the best? And so Sumus Medical Laser, not only do we have the finest therapeutic laser equipment to give the best and most effective treatments, but we have the most company experience, the greatest level of clinical and company support, and I would say that all of the people in our company are as passionate about this as I am. I love Class 4 laser therapy. I love what it has done for clinics and helping patients and helping as many patients as possible, human and animal patients. And top to bottom in our company, we are over the top enthusiastic about laser therapy. And just one more thing I'll throw in there: there are other companies that sell other pieces of equipment. With us, we are Sumis Medical Laser. We sell Class 4 therapeutic laser equipment. We specialize and focus in that.
Okay. So I will tell you, just as an aside, not that you need any pubbing up. I called your company and it was one of the most phenomenal experiences I ever had right from the jump. The person was personable, they were understanding, they were knowledgeable, and were able to give explanations even for someone who didn't have a breadth of exposure. And it was one of the things that led me to saying, you know what? I think this would be a great interview for people to have an understanding about medical laser, how it could be impactful to them, and really how it can touch the lives not only of themselves, but people that they care about. We're going to kind of like give a testament to our YouTube channel here for just a quick second, and we'll come right back and kind of get back into the details of medical laser and also field some questions from our viewers if they have interest. Back in a sec. All right. So again, we're here with Dr. Phil Harrington, who's given us the nitty-gritty understanding of what medical lasers can be able to do for a whole host of pain conditions and other conditions besides pain. So I know that there's got to be a question that's out there that's hovering, and I'm going to ask kind of that black swan question right off the bat, which is, does insurance cover it?
Okay, does insurance cover it? To some extent it does. And of course, I can't give a complete blanket answer there because, dealing with the different insurance companies and different policies and different states have different regulations. But let me give a general answer to that. For situations such as personal injury or workers' compensation, in those cases, laser is a billable procedure. One of the problems that we faced, and believe me, we're working towards this continually, is that there currently is not a dedicated procedure code. It's called the CPT code. There is not a dedicated CPT code for laser therapy. So, as I said, for personal injury and workers' compensation, most cases, 99.9% of those cases, the insurance will cover the therapeutic laser treatments. We are finding that private insurances are getting better at covering it also. And a lot of that comes in from, developing a scientific basis behind it, mechanisms of action, conditions that we can benefit. So it's getting better there. But, on the flip side of that, let me just, complete this answer by saying, we do have many clinics that have implemented laser therapy in their clinic as a cash service. And, let's just, again, I have to speak a little bit in generalities here, but let's think about two roads here. Let's say we have a patient who has neuropathy, diabetic neuropathy. And let's say that they're under proper care for their diabetes, but still their problem of neuropathy comes into play. Now, off the top of my head, I don't know how much they would be paying for any medications, Lyrica or gabapentin or anything like that. I'm not sure what their prescription drug costs would be. But what I do know is that any prescription medication they would be taking would have side effects. And I've heard from a number of neuropathy patients that got very frustrated at taking Lyrica just because of the way it made them feel. It just made them feel like they were in a continual fog. So you have all of those side effects associated with a prescription medication. On the flip side, let's take that same patient and treat them with therapeutic laser. Therapeutic laser, where the treatments have no side effects, where in most cases we are going to be able to give them some benefit, if not a lot of benefit. And the point I'm getting to here is someone will very happily pay a certain dollar amount, whether it's a few hundred or it could be even a small number of thousands of dollars, for a treatment that is non-invasive and has no side effects, as opposed to something that has numerous side effects. So the answer of insurance reimbursement for laser, it's an evolving story, but I think we're moving more in that direction.
So to that end, I was watching one of your own YouTube videos, and you talked about your dad would say, if you tell the truth, you only have to remember one story, right? So to that end, what would you say is one of the major truths about laser therapy that you think our viewers should know?
Major truth about laser therapy is that it is a treatment that is solidly based in science. This is not voodoo medicine. It's not, shaking a salt shaker around your head 3 times. This is science-based medicine. And I heard one speaker talk about it this way. Modern medicine with prescription pharmaceuticals, they look at the body as a chemistry problem, putting the proper chemicals in the body or chemicals to influence health. Whereas with laser therapy, we are looking at the human body as a physics problem. And I found that an interesting paradigm shift. We are using photons of light and imparting them into the body to create those beneficial effects that I talked about earlier of better circulation, tissue oxygenation, and cellular activity. So, the big truth about laser is that it is a scientific-based treatment that is non-invasive, non-ablative. It's treatments are very, very safe, and yet we can have certainly a positive effect on a large number of conditions. And then sometimes we can have these, as I referenced earlier, the patient with trigeminal neuralgia that was considering suicide, we can have these turnarounds in healthcare, in health status, that just literally blow me away. And Dr. Landrum, I've been the clinical director for Sumis Medical Laser for more than 13 years. And even now, even after all of that experience, I never cease to be amazed at the patients that we treat with the laser and how much it improves their quality of life. So, big truth about laser, based in science, here to stay, and it works, man.
So to that end, I think, I'm always impressed when I hear the science. But I know some of my patients, they care about the science, but what they really want to know is, how does it affect me, right?
Mm-hmm.
What is the connection to me? And so one of the things I'd be really curious of hearing about is, can you give us an example of a patient that just touched your heart, touched your soul, and said, you know what? This is why I do this on an everyday basis. And this is why this is so hugely important for people to know and for it to actually be more mainstream than what it is even now.
Okay. Well, number one, I would be able to list numerous cases of musculoskeletal complaints. As I said, trigeminal neuralgia, TMJ problems, tooth pain, shoulder pain, all the way down low back pain, plantar fasciitis. I could list numerous musculoskeletal complaints there. But an area that has developed in the last few years that especially touches my heart is, and let me just say that you've heard me say a couple of times that we use this technology on both animal and human patients. So, people love their pets and they want to keep their pets around. And specifically, I'm talking about dogs here. And a few years ago, we were contacted by a group that have the Westmoreland Terriers, the Westies, they call them, the little white, cute little white dogs. And unfortunately, every breed of dog has its own health problem to face. Dachshunds with their long back, they're prone to having disc disease in their spine. These Westies or the Westmoreland Terriers, unfortunately, will typically get Westie lung disease, WLD, Westie lung disease. It's comparable to idiopathic pulmonary fibrosis in human patients. And so a few years ago, we, as a trial, as an experiment, we started to treat these Westmoreland Terriers and treat over their lung fields. And it didn't take long for the pet owners to report that those dogs were becoming more active, that they needed less of their inhaler. They use various different bronchodilator inhalers to help them, that they were sleeping better at night, that they showed more energy, but then most importantly, that they were living longer. There is a certain period of time when a dog is diagnosed with Westie lung disease that it's expected within that time period they will pass away. Treatments with the class 4 therapy laser have been able to extend not just their length of life, but their quality of life. And then a few years ago, we had one of our chiropractors, one of our doctors in California. He himself was diagnosed with idiopathic pulmonary fibrosis. And basically at that time, he was told that within 7 years, most likely, chances are, you will be dead. So talk about that slap in the face of being told that you have a mortal condition, that within a certain period of time, the odds are that you will no longer be here. So that doctor, deciding that he had nothing to lose, used his own class 4 therapy laser, and he was treating over his lung fields. Of course, he could easily treat anterior. He could treat his lung fields in the front, and then he would have an assistant treat his lung fields in the back. And to summarize, he was given that diagnosis and told that he'd be dead within 7 years. Well, here we are today. The doctor is still alive. He is in part-time practice. He hikes and bikes every week, and he's had a number of pulmonary function tests, and those pulmonary function tests have improved every time. There was one time that it stayed static, but other than that, his pulmonary function tests, the scoring on his pulmonary function has improved every time. And as a result of that, he wrote information on various internet support groups for IPF, and patients around the world picked up on that. And I would estimate that about patients in about 35 US states have contacted doctors with class 4 therapeutic lasers, contacted me and asked for a referral, and have gotten treatment, and a vast majority of them have gotten better. And I've also heard from patients around the world. So, talk about a condition that, and Doc, this is where I'm going to get emotional. This doctor himself was given a diagnosis and was told within 7 years you're going to be dead. Deciding that he had nothing to lose, he treated himself with the class 4 therapy laser. And now 7 years later, not only is he alive, but I think it would be safe to say that hundreds, and maybe we're even getting into thousands now, of people around the world that had been diagnosed with IPF are alive. So they can be with their kids, they can be with their grandkids, they can go to graduation, so on and so forth. So talk about something so amazing and the impact that it had on the world and how it's able to change their life. It is just astonishing. And let me just add in that, this isn't just, I'll treat with the laser and it's an accident that it's getting better. No, we are getting more of a science-based understanding of, number one, yes, the photons of light will penetrate that deep into the body. They are getting into those internal lung tissues, but then also getting to a better understanding of the mechanism. How exactly is laser helping that lung tissue to heal? So a patient that has idiopathic pulmonary fibrosis, they are getting a lot of scarring. They get a lot of scar tissue in the lungs. Your lungs need that good, healthy, spongy tissue so that it can exchange oxygen to the bloodstream. Scar tissue in your lungs is a bad thing. And what they have shown on follow-up CT exams of the lungs is that either the scar tissue is staying stabilized, or there are cases where that scar tissue is even being reduced. Just to reassure that it is a science-based treatment, but talk about the impact and changing lives all around the world. It is just amazing.
So I gotta tell you, as I was hearing you and listening, besides the emotional piece of how impactful this can be on someone's just ability to be able to live and have quality of life, one of the things that you really hit on is a misconception that I have, which is the aspect of the non-ablative type lasers, they can only penetrate so far. And what I'm curious about is, can you talk about, what are some of the common myths, and can you debunk those and really give us an understanding about what this type of technology is really capable of?
Right. So that is one of the common questions when it comes to therapeutic lasers is how deep does it penetrate? And we as a company, being a very science-based company, we answered that question 10 years ago. And at that time, we had a very brilliant individual. His name is Dr. Brian Stevens. He has a PhD in oncology radiation from Vanderbilt University. One of the brightest guys, most intelligent guys that I've ever chatted with. But we worked together, Dr. Brian and I worked together with a boarded surgeon at Oregon State University, and we did depth of penetration studies. So when it comes to the question of how deep does laser penetrate in the body, really a better question is, how deep can you deliver a therapeutic dosage? So if we're looking at the lumbar spine of a very, very large patient, how do we know that we can get enough light down there to have a therapeutic effect? So Dr. Stevens designed a study on 3 levels. And number 1 level of the study was to use a water phantom, because our bodies are mostly composed of water. You just set up a laser power meter, a cylinder where you add water to it, shine a laser down on top, and measure how much laser light is remaining hitting the power meter. Second step in this study was to run Monte Carlo computer simulations, which are very high-level computer simulations that you run. But then probably the most useful and most real-world that we did was to enlist the help of that boarded surgeon, and they would make incisions in tissue, and we would bury a photon sensor in that tissue, and then they would use a caliper to measure, the depth, how deep in the body is that photon sensor, and then we would shine the laser at the surface so that we could measure going through skin, muscle, bone, layers of fat, all of those different situations, how much laser light is getting into the body. From that, we developed a depth of penetration curve, and then we shared that information in a poster presentation at the North American Association for Laser Therapy meeting back in 2010. Since then, there have been other depth of penetration studies done. And so one of the benefits of using, I mentioned early on, we are using red and infrared laser light. Infrared laser light penetrates very deep into the body. And the wavelength that penetrates the deepest is 810 nanometers. And so our goal is to get photons of light as deep into the body as possible, that 810 nanometer wavelength is a good choice in a therapeutic laser.
Okay, thank you. So one of the things that I'm really kind of curious about is, when we talk about lasers as a whole, are there any defining studies that you would say, or reference materials that patients or clinicians can be directed to? And the reason why I pose this question is, despite all the information that you've given to us, I know, because I have patients that will go back to their doctor and they will say, I'm really interested in pursuing this. And that doc, not having had the time or really the exposure to be able to look at this as a real strong therapeutic model, will say, that's a bunch of voodoo, like you
Yeah.
mentioned before. And
Yep.
really, what you want to be able to provide is a way for not only patients to educate themselves, but at times for them sometimes to educate their medical personnel. Are there some references that you can give to it?
Absolutely. And let me just give a couple online first that we could use. One is going to be on our company website, and the URL is medical.sumislaser.com. And Dr. Landrum, I'm sorry, I neglected to send you that URL before we started, but is medical.sumislaser.com. Or if you can't find that, go to our sumislaser.com website and send us a contact form. As an alternative, you can go to my personal website, drphilharrington.com, and contact me, and I could send you some more information. But let me just conclude this answer by saying that one of the top laser therapy researchers in the world, his name is Dr. Michael Hamblin, and his office is at the Wellman Center for Photomedicine, which is at the Harvard Medical School. So from that standpoint alone, to share with a medical doctor that at Harvard Medical School, they have a separate division on photomedicine. To me, that imparts a significant degree of authenticity. And Dr. Michael Hamblin has numerous papers out on photobiomodulation. There's one specifically where he lists all of the known and proposed mechanisms of action for laser therapy, photobiomodulation. And it's a long paper, and it's an extensive paper, but it does get in deep into the mechanisms and how laser. Yeah, so they're the Wellman Center for Photomedicine, and Dr. Hamblin has a wonderful research paper. But then there are other mechanism papers to support what is happening in the tissues when we shine laser light on the tissues. And then beyond that, as far as definitive studies, I would just say that it is very encouraging that we have a large number of studies, first on cell cultures and tissue cultures, second on small animals, and then third on live human and animal patients, so that the knowledge base, the scientific basis for photobiomodulation, for laser therapy, has grown exponentially over the last 15 years.
All right. Anytime you have a pub for Harvard and Mass General, you're my guy. So, all right.
Oh, you'd like that.
Thank you so much. So let's say that you have a billboard and you could put anything on it professionally in reference to lasers. What would you put on that billboard so that you could catch someone's attention and that they could learn something that would really be a take-home message?
Laser works. I would put laser works, and then underneath I would put our company URL, sumislaser.com. Sometimes it is very difficult to summarize in just a few words a technology or something that has impacted human life and animal life so much in the last 15 years. Maybe another answer to this question would be, whether someone reads the Bible or not, you can look to the book of Genesis, the first chapter, verse 3, and God said, "Let there be light." And to me, it is so beautiful that we are using light, healing light, to help patients in pain, to help improve quality of life, to help people feel better. So maybe I'll change my billboard answer and I'll just say, "Let there be light."
We'll give you 2 billboards. All right. So the question I also have, because I know patients are going to ask me about this later. So I'm like, let me get this right here on video right now. And I know it's going to be variable depending on the person as well as the condition.
Yeah.
But how much time would you say someone needs in terms of number of sessions before they can really be able to see some degree of benefit?
Right, and that's a good thing, and this is always a very important discussion to have with every patient in their report of findings when we're talking about a laser treatment plan. And the phrase that we always use is that the absence of pain does not equal the presence of health. In other words, just because we have erased your pain, it does not mean that all of the tissues are healed and as strong as they should be. So one thing that happens quite often with class 4 therapy laser treatments is that we can get people out of pain very quickly. If we use the visual analog pain scale, 0 is no pain whatsoever, 10 is the worst pain you've ever felt in your life. It is very common that we can take someone from an 8 down to a 3 on the pain scale in one treatment. And we have to make sure they fully understand that just because your pain is gone, it doesn't mean that our work is done here. So that number one, that is that discussion that we have, and we want to make sure that the doctor and the patient are on the same page when it comes to, yes, I understand that I'll be out of pain fairly quickly, but I understand that I must also commit to care to follow through to get the most benefit out of these treatments. Because frankly, if someone only does 1 or 2 laser treatments, it's wasting the patient's money and it's wasting the doctor's time. And neither of those, that's not a good exchange. That's not a good relationship. So what does happen, and this is supported by studies, is that repeated treatments with the laser will encourage growth of healthy tissues to help with repair and regeneration in those tissues. So at the very least, we would be talking about something such as an acute injury, a sprained ankle, a sports injury, 3 treatments over 2 weeks. So, or excuse me, I should say 3 times a week for 2 weeks, which would be 6 treatments. That's a very common treatment schedule for a sprained ankle. Whereas with something like diabetic peripheral neuropathy, a common treatment schedule is 3 times a week for 6 weeks, and then we evaluate after that. So at the beginning of care, the patient with diabetic neuropathy, they must understand that, yes, I need to commit to at least 18 treatments before we do an assessment of our progress. We're not going to make any judgments or make any changes in our treatment plan until we've hit that point. So one thing that I like about laser is that, as I say, we are truly healing the tissues. We're helping the body as a self-healing organism to heal itself. And so if we have a musculoskeletal complaint and we're able to treat it and, yes, get the pain taken away, but then also reduce the inflammation and help the tissues heal, we're actually making those tissues just as strong, if not stronger, than they were before the injury. So, once again, that is a little bit of a paradigm shift. If you think about, taking ibuprofen for inflammation or taking Tylenol for pain, we're not suppressing those things. With laser, we are helping the body to deal with those things in a way that the tissues are healed and made stronger. So yeah, treatment plans, in that 6 to 18 visit, but then as you say, it's going to vary depending on the patient and the condition that we're treating.
So to that end, I think that's one of the things that's really great about some of the synergistic improvements that you see with regenerative medicine, right? So as a pain physician, a regenerative medicine physician, frequently the things that we see is sometimes when we're treating the pain, what we are really concerned about is it coming back and it being cyclical in nature. And one of the best things about regenerative medicine is that it's trying to get to the underlying cause. It's trying to really stop that back and forth, just that piece that not only is it frustrating from a physical standpoint, but it's frustrating from an emotional and mental standpoint of saying, when is it coming back? And instead, it's truly a therapeutic intervention. And so that's really one of the best things about, I think, about laser and what it can be able to offer for people. So we have an incoming question that I think kind of really addresses some of this, but in a very simplistic fashion as well, because it gets to that person's problem. So Tony asks, does this work for joint pain? And so I think you can comment on that, but I'm going to let you, the expert, really kind of give us some answers about that.
Right. Does it work for joint pain? And I'll just give a short answer, yes. And yes, it can. I'm never going to throw out anything as a panacea. I'm not going to complain that we get 100% results on 100% of patients. But once again, if you're suffering from joint pain, it certainly is a solution to look into because it's non-invasive and safe, compared to your other treatment options for joint pain. On the extreme example, you know, I practiced chiropractic for 10 years in Iowa, and now I communicate with other practitioners around the world that use class 4 laser therapy. I know that in numerous cases we've been able to either prevent or postpone joint replacements. So if the joint pain is to the point where we're talking about a joint replacement, treatment with a class 4 therapy laser, we are able to either postpone or prevent those joint replacements from happening. So when we talk about osteoarthritis, osteoarthritis means that there is a loss of cushion in the joints, and there is a cycle of pain that gets put into place. You don't move the joint because it hurts, and when you don't move the joint, you don't get that nutrition in the joint. So then you get, further osteoarthritic changes in the joint, and it hurts even more. So you have that nasty pain cycle going around and around. With therapeutic laser, if we can break in and first help to diminish some of that pain, but then also inside of the joint, help with blood flow and help with production of synovial fluid in the joint so that it is easier for you to move the joint, then movement of the joint will help to prevent or delay the onset of the arthritis in the joint. So can it work for joint pain? Yes, it certainly can.
So as we come up on this 1 hour mark, where can individuals and viewers really be able to find more information about the medical company that deals with class 4 lasers that you represent, and also your personal branded site?
Okay, so our company website is sumaslaser.com. Once again, sumus is the Latin word for the peak or the pinnacle, and we really truly feel that we are the best at this. Sumus, S-U-M-M-U-S, sumaslaser.com is our website, and there is a contact us form there, and I look forward to hearing from any patients or anyone who's viewed this presentation, and feel free to shoot me questions through there. And then my personal website is drphilharrington.com, and I have a little bit of different information there, and once again, through there, you can feel free to contact me and with any of your questions about class 4 laser therapy.
Okay, we have another question, I think also from Tony, that says, okay, is this FDA approved, and is it covered, specifically the questions for Medicare? So I'll let you kind of address that, and I think that there's some
Okay.
nuanced elements to that, but I will let you respond.
Okay, yeah. The first is with the FDA. And it is a little bit of a difference in nomenclature, the terminology that is used. There is a difference between something being FDA approved and FDA cleared. So typically, traditionally, medical devices are FDA cleared. Class 4 therapy laser, it is a medical device. It is for prescription use, so it is sold to licensed physicians only. It is for use in the healthcare clinic, and it is an FDA cleared medical device. And as I said earlier, we got our first FDA clearance in March of 2005. There was another company that got its FDA clearance in December of 2003 for a class 4 therapy laser. That company has since gone out of business. But with Sumas Medical Laser, we got our first FDA clearance in March of 2005. Is it covered by Medicare? Unfortunately, no. So that's getting into the full answer for that is going to be a question for the insurance billing person at the office that you go to. It's really not appropriate for me here to go real deep into an answer there. But the billing person in the office that you go to would be able to answer that question.
Okay, so one of the things that I really want to pose is the following. If we're looking back at this 3 years from now, what has to have happened, both personally and professionally, for you to feel happy about the progress just in general for medical laser, as well as how this has impacted individual in their life?
Well, on a company level, it number one, it's going to be that steady growth that our company has had, and that the steady growth that the world of photobiomodulation has had in general. But something, one of my visions, one of my dreams is that we could see this form of treatment gain FDA clearance for wound healing. We have numerous cases in both humans and animals of different types of wounds, whether it's trauma, road rash, snake bite, post-surgical, where we can show that laser had a dramatic effect on the healing of those tissues. I think it would be fantastic if 3 years from now we had FDA clearance for these Class 4 therapeutic laser medical devices. Then every single wound healing clinic in the United States would need at least one of these devices, and the patients would benefit from that. And I know that we didn't get into a discussion of wound healing here because we don't have FDA clearance for it, and because it's a little bit outside of the box or outside of the scope for the discussion here. But I guess just realize that there is a tremendous amount of scientific evidence for photobiomodulation and helping with the speed and the rate of recovery and the quality of the healing for wound healing of various causes. So 3 years from now, if we had the FDA clearance for wound healing, that would be fantastic.
Dr. Harrington, I will tell you, it's been an absolute pleasure having you here, being able to answer all the questions that I've tossed to you and our viewers have tossed to you. You've been a fount of knowledge. Just to be able to talk about this technology with an understanding, both from a science-based component, but also from an emotive and emotional intelligence of how it really impacts people's lives. Is there anything else that you'd like to add that maybe I missed in terms of the context of our discussion today?
Well, Dr. Landrum, I just sincerely appreciate the invitation to speak with you, and you've been so generous and so informational with the emails that we had leading up to this, and then speaking with you today. You did some research on me. I did some research on you. And one thing that really struck me from the very beginning is how you are a compassionate and caring doctor. And, this world today, healthcare, we need more caring and compassionate doctors like you. And when I saw that video, I don't think I could hear the words in the video, but when I watched that video of your interaction with patients and how you made eye contact with them, that was very impressive. That really struck me. And so it tells me that you are honest and genuine, and you are, as I say, very caring and compassionate. But yeah, I just thank you for the opportunity. Thank you for giving me a platform to share my knowledge and enthusiasm and experience with your listeners and viewers. Class 4 laser therapy, it's here to stay. It's non-invasive, it's safe, and it helps so many people, so many animals with so many different conditions. It really is a wonderful thing.
Again, Dr. Harrington, thank you so much for joining us. Thank you for your kind words. And hopefully we can be able to make this therapy expand and really be able to have an outreach that impacts people the world over. Thank you.
Absolutely, I agree, and I really look forward to meeting you in person, whether it's at your clinic or meeting you at a future conference. I look forward to meeting you in person, and I have just greatly enjoyed our visit today.
Likewise. Take care.